Hi there, my name is Shelby Corley. I am a credentialed evaluator and CEO of 3Hive Consulting. 3Hive specializes in program evaluation, and we've been using the EQ5D in our primary care work since 2017. Today I'm going to share how we used it in a home health monitoring project in Alberta's Central Zone. This project, a collaboration between the Central Zone PCNs, Alberta Innovates, Health Cities, Boehringer Ingelheim, and TELUS Health, provided patients with chronic conditions a set of monitoring equipment to use at home for 90 days. They also had access to a TELUS Health portal, which stored the results of their daily monitoring and flagged results of concern for follow-up by a primary care network monitoring nurse. Patients were enrolled for 90 days at a time. An evaluation was an important part of the project. As part of our plan, we set out to measure patient health outcomes and knew that the EQ5D had broad enough applicability for the variety of conditions in our patient cohort, so we selected it to measure quality of life. Now, we hoped to integrate it into the portal to be convenient for patients. Unfortunately, the TELUS portal couldn't use images, and Euroqual requires that the VAS image be displayed. So instead, we had to use a separate survey platform. Patients would click a link that would bring them to this platform. They'd be directed to enter their name, then answer the 5 dimensions and the VAS. And we made sure to add instructions for those patients experiencing anxiety and depression. Now, we found this need to jump out to another platform challenging. Some patients would not click the link, some found it confusing, and some completed either their baseline or their follow-up assessment more than once, meaning we had careful data cleaning ahead of us. Relying on that external platform also meant that patients had to type in their name, which we chose over the PHN to be easier for patients. We were then faced with additional data cleaning work when patients spelled their name inconsistently between baseline and follow-up. In the end, only 78 of our 203 enrolled patients completed both a baseline and a follow-up assessment. Index score results showed a decline that was not statistically significant and confirmed that these patients had a lower quality of life than the published norms for Alberta. We looked to see how many individuals improved, remained the same, or worsened. And using a minimal important difference of 0.037, we learned that just over 60% were able to maintain or improve their quality of life. Now, our work would have been much easier if we'd been able to integrate the EQ5D into the portal we were using. This has been a consistent challenge for us in primary care. And we'd love to see local data on the impact that COVID has or hasn't had on quality of life as measured by the EQ5D. We'll use it again, definitely. Despite challenges, I do think that it's our best tool to measure health outcomes in primary care. Thanks for listening, and I'd be happy to answer any questions.